Good afternoon. Thank you very much for listening. I've already spoken with you a little bit, Linda. I'm a small business owner. I'm here as a private citizen. I am now a board member of CCHF, but I did not start out that way. I found them through my concerns on this very issue on health exchange. So just in effort of full disclosure. I'm going to very quickly give you a little background why I'm here and why I have some concerns regarding what we're doing here. A few years ago, Minnesota Department of Health stated in a similar public hearing that it was only forming an exchange so that the citizens, private individuals, would know what was out there, what options were available to them, and I think that was probably, 3 years ago is a long time in the IT world, right? So that was probably what somebody thought was the original intent. And I was concerned because first and foremost, what some others have discussed was the taxpayer expense. I know when you create something at the government level, however well intended, it will end up costing more than you think. And at that time, they also did not have the dollars available, did not have any information. The answer was, I don't know what the ultimate cost is going to be. And that was my concern with you gentlemen with the presentation was, you can tell us what you currently have with your pharmacy product, but this is very nebulous. It's moving and it's growing and it's doing lots of things I don't want it to do, but it's and you've even said it's evolving. You can't tell. That's very scary to a taxpayer like me, because if I were to ever hire someone, and as I said, background too, I used to be on Wall Street, so my first question was, what's your stock symbol? But, and I do admire what you've done here as far as a business plan goes and the information. I mean, it's impressive. It's so impressive that it also makes me nervous as a private citizen with my healthcare information out there. So I guess my question is to you is, before I would feel comfortable, if it were me hiring someone like you, I really need a lot more information on the cost side. It's basically, I wouldn't say, okay, T&M, time and material. You guys figure it out and let me know what it costs when you were done. It's just too great. But more importantly, with regard to this whole setup, I was assured by the Minnesota Department of Health at that time that it was not, and this is a quote, their intention to set up and this is now old jargon, universal healthcare type system where private patient information would be available. And then that evolved a little bit a year or two later into, well, we are going to get your private information, but, and in the case of a slightly different situation, we're going to de-identify it. We're going to make sure that no one can get into that. So in your case, I don't see, as a matter of fact, you said name, date of birth. I don't know if you said social security number, address. There's nothing that is de-identified, and that right there just makes my heart stop, okay? Because somebody's going to make an error somewhere, innocent as it can be, and it's out there. So along with cost issues, privacy issues, there is no, and we do know the issues with HIPAA. It's basically a consent to send your information to people like this. It's not really an informed written consent, not the way it's structured. You're depending on that, right? I'm really not going to be able to call you up and say, or I could because I know now, but my neighbor's not going to be able to call up and say, yank my information out of there right now, right? Is that correct? That's the way it stands now unless they know about you. There's no direct route. There's no link on the Minnesota to get to them. That's my question.
It would be going back to your provider.
Okay.
Saying, I don't want that information.
So let's say my provider makes a mistake. Innocent, boy, does it happen all the time, right? So you're sitting there and you're arguing with the doctor who sends the information back to the insurance company. You had that issue. Or if you're paying cash, usually not an issue, and there are almost never any errors, right? But if you were using insurance, at least as frustrating as that is and as time-consuming as that is, you're only going to your doctor and then your insurance company. If there's an error at the doctor's office, provider information, and then somehow or another, it happens, an error at your company, and then it's pervasive. It spreads, pardon the pun, like a virus, and contaminates your entire medical history, and has gone to so many places, so many fingers, that tracing it down is going to be more of a nightmare than we've ever seen, just dealing with our doctor and our insurance company directly. And my biggest concern, and again, coming from the investment world, I admire your business structure and what you've done. My biggest concern is how the patient isn't mentioned in this. It's the provider provides, and that's your business model. It's delivered to wherever it's delivered to, the Minnesota Department of Health, and that goes on to possibly the CDC for reporting purposes. We're not the idea. Nobody's asking me. Nobody's asking me anything. I have to know to go fetch this. So I'm wondering, you know, if there's anything you've considered to the true end user, right? Your true consumer. This is your direct consumer, but your real consumer is me. So how would you approach that? And then my final question, thank you very much, is do you currently have any contracts with the HHS on the national level or any other federal agency like that? Thank you so much. I know I had a lot there.
Great. Okay. Well, again, thank you, Maggie, for the information. I think the majority of the questions were revolving around cost, and then again the patient privacy and down to the patient level. From a cost perspective, again, I guess I totally understand where you're coming from as far as saying you're nervous about where the cost is evolving to and what that means from a consumer standpoint. The way that I would continue to address it is the products and services that we offer are made available, and it's a market-driven decision on whether or not that information or that service is interesting to the party. If they have a solution already, that's a decision that they can make on that. We believe that we can offer an affordable solution that will reduce overall healthcare prices as we're supporting the whole high-tech initiative of moving from a very administrative. We had one slide we moved through pretty quickly, but the cost of healthcare today, which is a significant portion of healthcare, is associated with administrative costs, and we believe through a lot of the initiatives that we're supporting right now can help reduce those overall costs by looking for efficiencies along the way. So hopefully, my healthcare and yours will be reduced, but it can't come at the expense of the privacy issues that you brought up at the end as well. The only reason we didn't spend a lot of time talking about the patients is not that they're not important to us, and we did have 2 slides that showed where the patients are, is that we have to depend on those that are interacting with the patients to receive that consent and to have that interaction. We're the infrastructure in the middle that doesn't have the personal relationship with those patients. The providers do. We have to rely on that personal relationship between the provider and the patient to say, there's a level of trust here. I'm giving you that level of trust. I'm consenting to that trust. And that level of trust has to be pervasive through the chain of that information flowing through. And we have to address these issues that you're bringing up because they're very prevalent, they're very important information. And I think, in the manner that these concerns are getting brought up and people continue to express these concerns is the best way that we can address them. I think we can't just ignore the fact that this technology and that technology is going to continue to evolve. We need to bring these forward and say, how do we address these situations that come up before they come up? And I think with the initiatives that we're talking about here, we're on our way to be able to do that. But I really believe that the patient's control needs to be handled between the provider of service and the patient themselves, and not some third-party person.
You don't have any offerings for identity protection, and I'm not talking about identity theft, I'm talking about healthcare. You don't have any way of sort of jumbling up the name and maybe associating it.
Well, it's all encrypted along the way, but the information that we provide, because it is healthcare data from one provider to another, the de-identified information is a completely different topic.
Right.
This is making sure one healthcare provider can exchange information with another
Okay, so
healthcare provider.
you don't address that at all?
It's all secure along the way, it's all encrypted along the way, but it's not be identified so the other party wouldn't know who that is. It would defeat the purpose of both.
Right, that's, I think that was my issue, yeah.
And just the last question on the, you asked about the contracts.
Yes.
Oh, I'm sorry, yeah, thank you very much. From an HHS standpoint, we do work with Medicare and Medicaid as far as financial transactions back and forth, but from a clinical situation standpoint, I'm not aware of any contract that we have with the federal government on exchanging information back and forth.
But that financial information includes what it was for, correct?
Yeah, but again, that's consent from a Medicare or Medicaid patient to deliver those services. They would consent to that insurance information being billed to the federal or state.
In order to get Medicare or Medicaid, you have to consent.
Right.
Okay.
And then we just pass that information back and forth for the conduit in between and making sure that payment information, which includes clinical information.
What
All
did you
right,
talk
we'll
about?
need to move on. Thank you, Maggie.
Thank you very much.
Thank you very much.
Next, we have Carolyn Kunke. Carolyn.